This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Welcome back to the show. We are honored to have our myofascial trigger point therapist, Craig Quaglia, joining us. He is our trigger point expert, and yeah, that's the website as well. We're excited that he's back here to talk more about all the work that he's done and has been doing for over 30-something years, and we're excited for him to have a beautiful guest on today, Marjorie Basso. He's going to introduce her in just a few moments as well. So first and foremost, welcome both to the show. How are we doing today, ladies and gentlemen?
Well, we're happy to say it's another great day in Chicago, but we know it's not going to last. Tomorrow, we're going to slide into what we call fibro weather, where it gets cold. And that's something we will talk about next week. So today, we get to enjoy where we're at. So my name is Craig Quaglia, as you said. I'm a myofascial trigger point therapist, although I utilize all kinds of other techniques and modalities, as does Marjorie. 39-year history. Graduated from the renowned School of Chicago Massage Therapy, which is no longer in existence. That's how renowned it was. It disappeared. Excuse me. In private practice, instructor for a year, 5 years at the junior college level. And, I had 3 clinics of my own. I was also part owner. The 3 holistic and functional medicine clinics is where I learned so much about where my practice is today. Being able to work with people at the top of their game, doctors, therapists, just changed the whole thing. This is where my holistic approach has emerged, and I'm sure Marjorie has a similar story there. Non-drug approach, we're both definitely non-drug approach people. Meet the patients and clients where they are. Validation is definitely a key thing. Currently in private practice, and just get to be on the podcast today. So after a rough start, we're getting into it. All right, so being a myofascial, I should get rid of this. Tacky. Being a myofascial trigger point therapist, this is a tough business. Part of the business is how do you get people in, how do you get to them? And that's constantly changing. You got to learn how to master that before you can get to the point where you can take care of them. So if we don't do that part, we don't get to do what we're passionate about. On the upside, it has opened the door, which is one of the reasons why I worked in clinics besides having a private practice. But the upside on the working in clinics is you get to interact with people, and you get to cross-train, you get to learn about things, work with psychologists, social workers, PTs, other myofascial trigger point therapists, visceral therapists, just the list goes on and on and on. But what's nice about it is you learn, you question, you become better at what you do. And without a doubt, my guest, Marjorie. We have done things together, but we've also done things that have taken us in different directions. And for weeks now, or for months, I've always talked about integrative or synergistic. So sometimes before I can do something, I have to reach out to somebody like Marjorie, who will have to do her part first, and she'll talk more about some of the things that she does. So the whole goal is, and the results are, to improve the quality of our patient's life. Here's the funny thing. Most of them do not call us until they've gone through the system, and the system is not working for them in some way, and then they reach out to us, and then that's how we get to work with them. And because it's a different approach, it's more of a holistic, whole body approach, where we can do pretty much what we need to do and not worry about codes and things like that. So now, in the past, I've often worked on a patient realizing that I'm the only choice they have in the moment, but I'm maybe in a situation where I'm not the best choice. And one of these is lymphedema. So the first guy I ever had, patient with that, he had a swelling of his leg. And when I'm talking about swelling, we're not talking about a little bit from an ankle strain. We're talking like to the sides of an elephant trunk. So that really impacted his life. So I did the best I could to work on it, and it helped a little bit, but it wasn't the thing. I wasn't the person for that. And I'm happy to say now that when I get cancer patients who some of the side effects of their treatment often produces lymphedema, I'm able to integrate and work with another therapist who does manual lymphatic drainage techniques. And this is where Marjorie comes in. I'm happy that.
Yes, please introduce yourself, Marjorie. Tell us a little bit about you.
Hi, I'm Marjorie Basso. I've been doing massage therapy since 1988. I started in Michigan and then I moved to Chicago, started all over here and practiced. I ended up working in a chiropractic clinic for 25 years. Now I'm just in practice with myself in conjunction with other therapists at Tribe Healing Arts in Chicago. It's a bunch of different therapists. But I got interested in manual lymph drainage because I had a colleague that had been doing manual lymph drainage for quite some years. She'd been going to Germany and getting incredible training because there they do a lot of manual lymph drainage. It's just part of the protocol whenever somebody has an injury or has surgery, they make it because it really accelerates healing. So she was telling me, look, I'm getting more business than I can do, and I need someone I can really trust that's trained correctly in manual lymph drainage that I can refer to. So a friend of mine, Kathleen Casey, and we took the close training, which is the Vader technique, which is basically how manual lymph drainage was created by the Vaders in the early 1900s. And they have a lot of research behind their technique that shows what it can do. And then we took the training and we got lots of feedback from my friend Madge Lockwood, who actually teaches manual lymph drainage now in the Chicago area, and she's up in Milwaukee. But it really opened up a whole nother branch of people who need therapy that weren't getting it. And the lymphedema people, the cancer people, the people post-surgery, the people who are injured, people come in from bike accidents or car accidents. They have bruises all over and contusions, and just they're also kind of in this state of sympathetic nervous system where they're just in that flight or fight stage. And one of the best things that manual lymph drainage can do is calm that down and help someone go back into a parasympathetic state where they can heal. Because when you're in that state of trauma, your body is not taking all the energy toward healing. And if you can get someone to calm down, help the pain levels come down, that's another thing that manual lymph drainage does really well. It helps, it has that analgesic effect. So it's taking the chemicals that create that the nerves pick up on that create those signals to the brain. Pain helps bring that waste away from those cells and those biochemicals that create pain. We're kind of, did you want to say something?
Yeah, no, I'm going to have her bring the image up. Can you bring the image up that we?
Sure. Well, I don't have the image, like I said. I have the link to the
Oh,
website.
okay. All right. That's all right.
Because there was no
All right.
attachment on it. Can you share it? Do you want, that's, yeah.
Probably not. So
Yeah, no, before we start, I let you know that your email did state that you had, it was the attached or two graphics. That was for the old one. And the only thing on the attachment is the old ones that we used last week.
Okay.
That's okay.
That's okay. We'll run with it. So most people are familiar with two systems, the arteries and the veins. We're talking about the lymphatic system drainage. And this is a system that operates independently of the other two systems. So one of the things I pulled off of our website, I didn't know you did headaches too. Sinus congestion, lymphedema, Lyme disease, post-surgical pain, swelling, stress, long COVID. That's one we should talk. We could do a whole show on.
Yeah, we've done a lot of long COVID patients.
I'm sure.
And it does really help.
Yeah.
People who are COVID sort of brings up people's autoimmune conditions that they thought they had managed and under control, and then they get COVID and things are kind of back. We also work a lot with chronic fatigue. So, and there's a whole nother sort of branch of manual lymph drainage called the Perrin technique that is specific for chronic fatigue and long COVID and fibromyalgia. And there's a lot of people in Chicago area now that are being trained in Perrin technique.
Wow.
So there's a couple of techniques in manual lymph drainage that have a lot of research behind them that show how people do get better. And I could just say from experience, someone comes in, they're kind of, if they're post-surgery or chronic fatigue, they've already been to the doctor, they've already gone through a lot. So it's nice for them to have the hands-on work, which manual lymph drainage is hands-on work. It is not a machine. It's not, some people do use machines for it, but that's not what manual lymph drainage is. I don't know. That's something else, but manual lymph drainage is the hands-on work. So it's very gentle.
How is it different from massage?
Well,
the amount of pressure you're using, versus when we do myofascial stuff.
Okay, so it's a different system of the body. It's not muscles and skeletal. It's a very fine system in the skin. So you're just moving skin. You're not addressing muscle tissue. So it's very, very gentle. That gentle effect has an effect on the nervous system. It's they call it the gate theory, where your gentle work shuts down pain receptors to the brain. So that's another way it helps with pain.
So in the nervous system, we have two systems, the parasympathetic and the sympathetic. The sympathetic is the one that's working right now with you. Allows your eyes to blink automatically, all the things that you don't pay attention that your body does all day long.
And if this is what we're talking about, let me just confirm, because this was on another email from Mark Daniels. This is correct? The
Yes.
Yeah, it wasn't attached to your original email. Sorry about that. I kept looking for it under your name. Go ahead.
Okay. So you can see that system goes into the brain. She's talking about working with the sinuses, and you can see all the different organs that are impacted by that.
Yeah.
And this is where I let Marjorie take over, because things like the spleen are not one of the things that I'm that well versed in. I know liver, I know, of course, the heart. I understand, especially through craniosacral drainage, another technique to help drain sinuses. I didn't realize you could do it with what you're doing.
Well, the lymphatic system is really connected to the cranial
I could see that
system there. It's just, in fact, it has a similar rhythm of 10 to 12 beats per minute. So you get into a rhythmic sort of massage technique when you're doing manual lymph drainage. And that also is very relaxing for the nervous system. And of course, craniosacral is you're working with the nervous system. So in fact, the last 10 years, 12 years, they know that there's a whole lymphatic system of the brain. And a lot of our work helps. That's why it helps with chronic fatigue, because you have this, they've discovered you sometimes have this backflow to the brain of lymphatic waste that's not getting drained well.
Yeah.
So manual lymph drainage can get that system draining in the right direction.
So you're breaking up the buildup.
Yeah.
You're moving it away, the waste, because that's what lymphatic drainage does. It's bringing protein and nutrients to the cells, but it's also taking away the waste and the buildup of waste and toxins, that viruses. It's part of your immune system.
Where'd it go? Yeah. There it
so
is. Okay,
unlike massage and maybe even myofascial, you can use this when somebody has infections, correct?
If they're at the beginning of getting sick, you want to wait because it can spread it.
Okay.
But if they're at the other end of it, like with COVID, like let's say they had COVID, you wouldn't want to work with somebody who's just in the middle of it or in the beginning of it. You want to get them when they've on the back side of it, and then you can help clear things so they don't have long COVID. I mean, long COVID for some people is like chronic fatigue. They're like foggy for a long time, or lose their sense of smell and taste for a long time. Lots of different things happen.
Yeah, I've had people, and COVID, by the way, is rearing its ugly head, at least around here again. So we're not going to be surprised if anything happens with that. So with surgery and radiation, when are you allowed to go in and start working on it? Do you have to wait till after the treatments are done, or?
With radiation, you should probably wait unless the doctor tells the person to go ahead and get it. But even with chemo, if people are taking chemo drugs, you might wait like a few days after. You want them to, because manual lymph drainage is going to make everything move faster. So those chemo drugs are going to move out of their system faster, and they want the chemo drugs to be in there killing the cancer. So you don't want it to move too fast out. If you really want to be on the safe side, you could probably finish your treatment, your cancer treatment, and then go and get some manual lymph drainage to get a lot of those toxins out. Also, there's a lot of dead tissue with those drugs. So you want to get that out of your body, sooner rather than later. You're trying to accelerate it.
Does this work with compartment syndrome, where say after a car accident or a break in the arm, the tissue swells so bad that it starts to entrap literally entraps the tissue and the nerves.
Wow.
Yeah, we get some really.
I would. It's supposed to help with whiplash and all that. And I've worked with people with car accidents, and even with post-surgery, if you've got injury, someone is getting incisions, you've got damage to the lymphatic system and everything. And by getting some treatment, you can reconnect that system. And a lot of times with lymphedema, that's what you're doing. You're finding a new way to route the fluids, because that's the lymph system is basically a transport system. It's transporting fluids in and transporting fluids out. So if you can get it all reconnected, and a lot of times people with cancer will wait kind of a long time until they have a problem, because they'll have a susceptibility towards lymphedema for the rest of their lives. But if they can get a little bit of treatment and their bodies can find these new ways of transporting the fluid, redirect the fluid, then they're going to be much better off.
So do you do like what we do with other modalities? Do you teach their partners how to work with them? Are their partners open to this kind of stuff? Because I know some guys, when you talk about working on their wife, or especially post-cancer, it's like, no, I don't feel comfortable doing that. So
no, I don't. But with chronic fatigue, you might teach one of their friends or their family members a little bit of the parent technique.
Okay.
There's a lot of those videos online, and they need to do a lot of self-care. You can teach the person themselves a little bit on how to work on themselves when they have lymphedema.
That's a good one,
but you don't want to get it, you don't want to make it too complicated, and then they're pushing the fluid in the wrong direction. So you try to keep it simple.
And I apologize, but we are out of time.
Are we?
Yeah, because we got a late
can
start.
Talk. Me and Craig can talk.
I would love to have
Sorry.
you, let me just stop my screen here. If you don't mind just kind of summing up for today, and then tell us how we can contact you both.
You can go first.
Okay. Well, there's a lot of information about the manual about lymphatic drainage now. People are seeking it out. It's worth looking into it. Even just average people a couple times a year, get the system moving. Getting a treatment, will accelerate those pulses of the lymphatic system. So it really does work. You can find me at ChicagoLymphaticMassage.com. And I also have a colleague, Kathleen Casey, that works with me. We try to help whoever wants to come. If you've got autoimmune conditions, it also helps with that. So
perfect. Well, thank you so much. How can we contact you and Craig?
CraigQuagliaTriggerPointExperts.com, 708-524-8812. And that's the end of our story for today.
Thank you so much.
Thank you so much. Pleasure getting to know you. Hope we get to connect more again next time. And thank you both for being here and being patient, right? Technical issues. Glad we got it fixed, guys.
we expect it. I always expect it now. So,
No.
all right. You have a good
Thank
day.
you so much. Bye-bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.